Good afternoon. After many speeches given by esteemed leaders, let's go on with, this is the last panel, right, of the day. So collectively, let's see what kind of solutions can we provide to some of the challenges we have in this region and hopefully for the future. The topic is aging pandemics and path to innovation. It's a conversation about implications of an aging population, lessons learned from COVID, and innovative approaches to healthcare. And we are so glad to have the three gentlemen sitting on the stage. Kevin Xu, CEO of MEBO International in the middle. We also have Fernando Rios, CEO of Rimac Insurance. Last but certainly not least, Ted Chang, CTO of Quanta Computer, Inc. So good to see the three of you. We would like to start by every one of you helping us to understand how you would come in to this conversation, from which angle. Fernando, because the topic has a lot to do with the pandemic, aging, and innovation. I know you want to link what we learned from the pandemic to the aging issue we're facing. So please, let's start from you.
Our healthcare systems are under pressure, under stress every day. If we continue doing the same, it will only get worse. And we learned from the COVID-19 pandemic that we need gaps in our systems to face this challenge. We must cooperate, we must collaborate, but at different level, with more sense of urgency. We can't wait to have another pandemic to start acting together. And we propose to work in two specific spaces together. One is resource allocation, vaccines, medicines, tests, and the other one is knowledge sharing, protocols, information, best practices. Because we think that only together we can build the resilience we need to face this challenge.
Thank you very much, Fernando. I'm sure you have further details to explain to us a bit later. Let's go to you, Kevin. Tell us more about which angle you are coming in. As far as I understand, you are in the field of bioscience.
Well, first of all, I think it's an honor to be here and talk and share the insights with the CEOs around the world, especially in this impact platform. I believe, especially after the pandemic, because for us, we actually understanding there's a balance between the needs of advancement in technology, but also how we really taking care of a people-centric directions for the next breakthrough of science. And we know that the urgency is needed, especially when we're trying to prepare for the next pandemic, but also because there is a overburden in the global population that grow more aging alike. And because of that, I still want to stress on the fact that we have to find a balance point. And for us, we understand that aging is a course of life. And there are unmet medical needs. How we figure out the right way to physiologically help people successfully age, and meanwhile achieve the advancement of science and technology, that is our priority. So therefore, all these new technology which is being developed, or all those devices, have to be considered for the best fittest to the aging population.
How to so-called successfully aging. Yeah, thank you. Let's go to you, Ted, please.
Yeah, although everybody talk about technology, but technology is not the future. And Quanta Computer is the biggest computer maker on this planet. But Quanta Computer is not AI, but without computer, there is no AI. But AI could be useless. If you apply AI, cannot make our medical system or health system much better. So the goal is basically whether we can apply the right technology, integrate into a new environment to support the society of the future. And the biggest challenges right now, of course, is the growth of elderly population. And so we will be lack of enough medical resource, enough medical doctors, and we don't have enough the nursing center to host everybody. So one of the thoughts is that can we do aging in place, but still we can provision a much better professional medical care directly to the elderly at home. So that's a simple thoughts from the technology side, but it could be applied to many new applications in the future society. Thank you.
Ted, your thoughts on what can be the priority? I mean, certainly you're a digital guy. You suggest AI all the time. But even about AI, there are AI gap we have been talking about throughout the past 2 days. There's also policy about AI. As you know, there's so-called AI Act in certain countries, which means that technologies of somewhere might not necessarily have access to in other parts of Asia Pacific in the future. So how do you see this, AI, quote unquote, as solution?
Thanks for the wonderful questions. I think the most important thing is that we need to place AI at the right positions that it can create, the biggest value. That is the first thing. For example, to do that, you need to do understand the real world problems so that you can collect the right data and provision AI as a service at the right, place. So basically, one of the example I can tell is that more and more elderly, are facing, the 4 problems. When people fail on the ground, and basically, it's very difficult to, to call other peoples because you are underground. And if you want to put, vital sign sensors or wearables attached to a person, then it's still, it won't work in all occasions because sometimes you are in the toilet or in the restrooms and you are taking a bath. And so one of the technologies that using different kind of radar to scan you, get out the point cloud. Based on the detection of the point cloud, they understand your gesture and posture, and then we call for example, your son, your neighbors, and to help you. So that's one of the very simple the applications that simple AI can help. So I'm not talking about generative AI, large language models, but of course for generative AI they can help you to find drug a much better drug in a short period of time. But deep learning AI actually very helpful in deploy to the real environments, so that you can educate more people and to let them understand what AI can help, and so that they can increase the adoption of AI. And so that's another direction.
These gentlemen are certainly logical in providing their solutions, and they are everywhere in terms of the priorities. But I want to remind you of the urgency, if I could. I have 2 personal stories to tell you, not about me, but rather about people I know. For example, nursing home. As we see populations, for example, in Northeast Asia, Japan, China, also South Korea, I think, aging population in urban areas, a big challenge. You will see people line up years in order to get their parents into some of the best quality nursing home because they want to show their respect. It's the cultural tradition of our region. But it is so hard to get in that people of my age and even younger, they're already thinking about pre-registering for themselves when they are getting old or getting aged. That's one example. The other example is one of my girlfriends who's also a public figure. And of course, you get friends to invite you to dinner or to social occasions. So she told me she would not accept a lot of them. But if there are presidents coming from hospitals, friends like that invite her to dinner, she would love to go to because she would say to them, please take care of my parents. Stories like these are so real in the region. I think every one of us is a daughter, is a son, is a parent. Many of us are parents as well. So how that story of urgency is tapping into your years of solution, that's what I want to hear, if we could, for the next 8 minutes.
Well, I just want to say it's really important that how we really gather the information we receive and find a universal standardization. And then we take the next approach right? Because we knowing that, especially we know there's medical needs among different countries because of their diversity, because of our different backgrounds. There are always going to be different ways of communicating. But however, the key here is we have to work together, not only with government, the private sector, but also with the nonprofit, the association, which they also have the direct contact with the patient advocacies, with others, research scientists, because we know that there are always going to be a universal care for the world. And that's the major part that, for example, there's a lot of opportunity to have briefing sessions among different regional leaders in development of science related to aging, related to other advancement. And that's what we need, is to gather these leaders to have a reach to a collateral of agreements.
If I could just follow up, because there are certain products that we are doing trade, which is contributing to solving the problems of aging. Whether the trade policies are going to be friendly to those exchanges among economies, it's just one of those many questions we need to ask today, given the circumstances of our meeting today. So Fernando, go to you.
It's something totally urgent to face the aging challenge, because imagine that we want to be in shape when you are 70 or 80 years old. You need to start today doing exercise, eating healthy, because I will insist in the approach of we need to develop preventative care now. We need to move the healthcare system from curing people to caring for people. And we need to start doing different things today. Exercising is hard, eating healthy is hard, but to live with diabetes or a heart disease is harder. So we need to invest in new services, but at the same time, we need to invest in preventative care.
Yeah. There's a long laundry list that we need to do, I see, but the question always is how, right? Go to you, Ted.
You are asking a very tough question. What would be the urgent question, right now? First of all, I think something we have to do right now is because aging is not a process of getting old. Sometimes you will get old right away, within one day, according to the research. The second thing is that once you suddenly get old, you are incapable to do something. What would be the society can support you and to get your life back to normal? And that's what technology is trying to accomplish. But imagine if a city with full of elders, that also, in reply to your questions, the smart city of the future is your future nursing home. They have to host millions of elders in the city, which means that we need to restructure the city, make it friendly to all the elders. And the elders is not another group of people. It's our future. We will all get old. So we will need to start to consider what kind of city we would like to stay and what kind of problems that we're going to solve. And this would rely on, just like Kevin just mentioned, rely on huge amount of public-private partnership. It also rely on how we can connect our limited medical resource through telemedicine, telehealth, and also AI, and to make up not 100%, but at least we can further improve that. And another thing is that how we can keep elderly healthy enough through health promotion programs, exercise, and also society programs, social programs, to bring everybody out of the home and to live a much better life. And so that will be a very complicated problems in the future. But I think the urgency is that we all need to do it right now. Otherwise, we will get old quickly. And we don't know when, It's not about age. It's about your mental and physical condition.
It's also about our priorities in looking at the future, how we are going to re-streamline the structure of our economy, our society, in order to fit into the realities of tomorrow. So ladies and gentlemen, thank you so much for this session, and thank you also for your contributions. Thank you.